Oh, should you take that therapy client or not? So, when starting a therapy practice, all therapists are faced with this question: should I accept the client or should I refer them to another therapist? If we know our expertise and we also know our level of skill and our ideal client, then this should not really be a difficult question. In fact, it should be an easy question to answer. Many of us are just so focused on trying to start a therapy practice and build it so quickly that we are willing to take anyone. Now, I want to tell you some things why I believe that this is a problem, and then also work with you on trying to help you to develop a better way of filling up your therapy practice with the people that you actually desire. So, the first thing I want you to think about is just really intuition. Intuition is something that we are given just through us being a human being. So, according to Oxford Languages, the definition of intuition is the ability to understand something immediately without the need for conscious reasoning. Basically, it's our innate ability to know like what's right or wrong without even having to do more research about it or wait more time to figure out how it's going to play out. You can think of it kind of like a red flag. When you meet someone through like a friend, and then it's just something about that person that feels off to you, or you just can't trust. Well, our intuition does not go away when we become therapists. So let's talk about how many times as therapists we have the decision to listen to that intuition or not. When we receive a new referral or are going through just the beginning stages of a pre screening, that is our first opportunity to actually utilize our intuition. So there may be like certain behaviors or certain symptoms that you're noticing that just doesn't really feel too good. It could even be like a personality trait that you just feel like doesn't really vibe that well with you. Now, I get it. A lot of therapists, especially great therapists, feel like, oh, we could just meet with anyone. It doesn't matter who they are, their background, or if there's any even personality differences. I completely understand that. But let's talk about you taking that client 6 months down the line, even a year down the line, because many therapists do this. And now all of a sudden, what seems to be almost like a pet peeve in the beginning turns into more frustration, and it's just more bothersome and more stressful for you later on down the line. Now, that 3 o'clock appointment that you are completely dreading has now impacted your 2 o'clock appointment. You're in your 2 o'clock appointment. Now you have the session. Even the client is starting to feel like something's a little bit off. And it's from that energy because you are emotionally preparing yourself for this session at 3 o'clock that you really don't want to have. Now, this is all because you did not trust yourself. You did not trust your intuition from the very beginning when that client was not an actual client, but they were just a potential client, right? Our intuition can actually support us in being more present to our clients. And, not just physically, but also emotionally. It can help us to be there more emotionally for our clients' needs. It helps us to detect even possible threats that a client may be experiencing that maybe for whatever reason at that time they're not able to convey it to you verbally. You can tell just through our intuition from hearing what they're saying that there may need to be more questions, may need to be more investigating on what's going on that could even possibly protect them. So I believe that knowing when to trust your intuition is actually what makes a great therapist, a great mental health therapist. The deeper rooted issue is that many therapists do not see their level of skill, greatness, and they don't even believe in themselves enough to trust their intuition. So today I challenge you to trust in yourself. Trust the compassion that you have for people and trust the passion that you have to do this work. Look, running a therapy practice is not easy, but it should not be something that is overwhelming you, something that is stressful to you, and that's causing you to not even look forward to doing the job that you have started. Be confident in your ability to not only start a therapy practice, but to run it successfully. You are getting into this practice. You're starting your therapy practice. You're building your therapy practice because you have a desire and a passion to serve other people, and you want to make a living from it. So you need to have something that's going to not only serve the people that are coming into your practice, but to also be able to help you to live the life that you have been born and that you dreamed to live. So remember that the choice to who even comes through those doors or who you even see through the video in your telehealth practice is up to you. Use your intuition. It is something that we all as human beings have, but the best therapists know when and when not to use that intuition. And remember to always work and live authentically. Take care, authentic therapists.